Hello, Lisa and Carrie. I'm in the presence of the Minister of Health, Terence D'Alsing, and we're going to discuss World Diabetes Day. Just to bring some statistics, according to the International Diabetes Federation, there are over 425 million people in the world living with diabetes. And just to bring it home, according to some information from that federation, there are over 117,000 people living with diabetes in Trinidad and Tobago. Minister, exactly what does that mean?
What that means, and first of all, thank you for having this program. What that means is that we are a very sick country when it comes to diabetes and the whole issue of non-communicable diseases. It means that people are not living fulsome lives, they are not living well lives, and they are dying prematurely. Over the years, diabetes has risen from being about the 7th cause of death in Trinidad and Tobago till now it ranks about 3rd. So it has jumped 4 places to be the 3rd highest cause of death in Trinidad and Tobago. And that is something we should be concerned about. Having said that, on becoming Minister of Health, when you start to look at hospital statistics and you see one of the major reasons why people are hospitalized and seek medical attention, it has to do because of the complications of uncontrolled diabetes. And what is so sad about this is that many people who have uncontrolled diabetes and who develop diabetes, by implementing minor life changes, minor lifestyle changes, it can have a significant impact on their state of diabetes and their wellness.
Okay. Minister, I know last year the ministry would have embarked on a NCD program, taking it from 2017 all the way to 2021. Where are we on that program?
So we launched our NCD program via a loan from the Inter-American Development Bank. The strategic aim of the NCD program is to reduce the incidence of NCDs, non-communicable diseases, by 25% by 2025. So the program started last year, 2017, so it's basically an 8-year plan to achieve that target. You will start to see strategies being implemented to achieve reduction. So for example, we have a crisis with children and obese children and children with diabetes. So one of the things we did was to ban the sales of soft drinks in schools. That has gone down well. The other things that we are doing is starting a program, hopefully in the first quarter of 2018, to start testing all our pregnant women for diabetes. That's a big issue. The whole issue of what we call gestational diabetes, diabetes in pregnancy. So we are trying to tackle all the main subpopulations that succumb to diabetes. The pregnant women, the children, and we are stepping up other activities that we will roll out within the next 2 to 3 months. So I could tell you, and you'll be the first to know, that we'll be rolling out a program called Water Wednesdays, encouraging people to drink more water. Fruit Fridays, to encourage people to eat more fruit. And Shape Up Saturdays, for people to get more physically active. Those are 3 easy pillars that if everyone adopts as a lifestyle change, can have significant impact on their wellness.
In terms of the financial strain on the Ministry of Health, because it's a behavioral issue. So in terms of how much money would you say the minister has to spend each year to assist?
I don't have a figure for diabetes, but NCDs, non-communicable diseases, there was a report commissioned by the Inter-American Development Bank, and they estimate it costs the country in both direct medical costs for both the public sector and private sector, and indirect costs due to things like lack of productivity. It costs this country about 8.5 billion TT dollars per annum to manage and control non-communicable diseases. And the budget for the Ministry of Health is $6 billion a year. We don't focus on one day for diabetes. Diabetes is a fight that we wage 365 days a year. World Diabetes Day is just one day for heightened awareness, but we live this every single day. We are constantly implementing policies. Like for instance, we are looking at people who come to our emergency rooms as revolving patients for diabetes. And we are now treating them at home so they don't have to come to an A&E very often. We go home by them now and look around, play detective, see what your kitchen is like, what you are eating, what you are cooking. Make sure you are taking your medication so you don't have to come to an A&E. That's the preventative side of it. That combined with our wellness centers that we want to launch throughout the country, the education, exercise, change your diet, change your lifestyle, all of these things are what we do every single day. World Diabetes Day is just to highlight the issue.
Okay, thank you very much for speaking with
You're
the
welcome.
Minister. Back to you, Carrie and Lisa.